I don't know about you. The lunch is slowing me down a little bit. It's all slowing me down very much. So, how has it been so far for you? Very useful. In what way, sir? Okay. You think you can take it back? Okay. Okay. And young postgraduate students, what are you thinking? What are you thinking? How, so far, what's your feedback? So that we can do something different if we can do it different than last hour. Just let me finish that. Yeah. Okay. And what do you think so far is the key message here? Communication. Vigilance, communication. Okay. Team and yeah, get people to work for you. Teamwork. Okay. So vigilance, she mentioned. Sorry, what's your name again? Shruti. How are we going to be vigilant here? What is that we have learned so far? Okay, so because vigilance was something I was not specifically mentioning, but we were talking slightly in a different explanation, like situational evidence. Yeah, vigilance is a very important one. So just we can. Yeah, that's it. I might have to bring a law to cut mobile connections in the hospitals. Who knows? Anyway, so this is the final two sessions. Hope you will enjoy the other two as well as much. I hope you enjoyed the other two. And who's the team who's going to be performing now?
Which you should have the slips with you. Have you got it? Orange. The
Orange
team
team.
orange to step forward, please.
Yeah, please come forward, please. Orange team.
Come on. There are 5 of you. Okay.
Oh, okay.
Right. So.
I'll get the form. Have we got the sheet just now?
Cheers, Sendil.
Yeah.
It's with me.
You good?
Sorry, man. Just a minute.
Yeah. Give a 4 is enough. Yeah. So who has so far been a lead participant in this team? Who has done the senior role or the lead anesthetist role so far? One, you have done? Almost. He has not done it. He has not. You have done one?
There's a target there.
And you have done one? Oh, you've been a part, sir. Okay. Oh. Okay. So you want to give the opportunity to the other? Okay. And which year are you in, ma? Final year. That's good enough. And you? First year. Okay. And which year are you? Practicing. Okay. You're a very.
It's a compliment, ma.
Compliment.
You look so young.
Okay. You're in practice. The scenario is
Here.
we got a 55-year-old gentleman. No, this is not the one. No, this is not the one. That's not intro.
Oh, that was.
Oh, yes. So the scenario is going to have a senior anesthetist, a junior anesthetist, an anesthetic nurse practitioner or a nurse anesthetist, whichever you call it, who's going to be helping the anesthetist. And there is going to be that surgeon somewhere in the background will come and go.
And we'll have a spare anesthetist coming
Oh, yes. And there will be somebody who's working next door in another theater. So, roughly speaking, we're going to divide these roles. We will divide the roles once I've said the scenario, see what you're comfortable with. So, the senior anesthetist is going to be supervising the junior anesthetist, teaching and supraclavicular brachial plexus nerve block, and it's going to be a landmark technique. And this patient has come in for an elective procedure on the right arm for a tendon transfer surgery due to previous traumatic injuries. This is a reconstructive tendon transfer surgery. The patient has not got any medical problems as such, and normally your hospital, this hospital is going to be most of these procedures are done under general anesthetic. That's the scenario. No, sorry, regional anesthesia block. And this is the scenario here. Who is going to be the lead? Okay, you want to be the lead
So,
anesthetist.
little reversal in load. Let sir be the junior anesthetist. And you are which year?
Senior. She's
Finally, yeah.
Okay, you can be the senior supervising sir.
supervising.
Okay.
Okay. Shruti, you wanted to do the role of ODP. Shruti, can you
Yes.
have you done the role before? No, you've not all done. So, okay.
That's okay if you want to observe.
You want to do any other role? What would you like to do? You sure? Okay, so you be the nurse person.
Pull the mic up.
Okay. And you will be the anesthetist working in the next theatre. Okay. So if you just go and stay there for a moment. Okay, right, so good. The patient is there. The procedure has not commenced. You're walking into theatre to do a
Supraclavicular.
brachial plexus block. Off we go. Over to you. And the patient can talk, patient can respond, patient will do all things. It's a real patient.
My role,
Okay.
I didn't get my role. I didn't get what's my
I'll
role.
be performing,
What's my role?
I'll be injecting in your neck region, after which you will have numbness of the hand and you won't feel the pain of surgery. Initially, there will be some pain, which will include a needle prick. So don't worry. We will make sure that you don't have pain while the surgery is being performed. Now you just have to cooperate, for which you have to turn your head to one side.
Why can't I have a general anesthetic, madam?
There are some complications with general anesthesia which we can avoid by giving regional anesthesia. Regional anesthesia is considered much safer compared to general anesthesia, and since it's a fracture on the hand, we can just anesthetize that part of your body and not completely.
Madam, I'm very scared about this, and somebody said that I might have a dropped hand. One of my fellows who had an operation like this, he had numbness in his hand all through his life.
Any procedure will have its complications, but the complication with this kind of technique is minimal compared to the general anesthetic.
So you do think this is a better option for me?
Yes, this is a better option for you.
Okay. I'm not very sure that this is what. Okay, I have to go by your advice. Okay.
Don't worry, we'll make sure that you're not aware of what is happening in the operation theatre. We will sedate you enough so you will be able to have a sound sleep.
Okay, madam. Can I have some sedation?
Yes. You initially 1 milligram IV midazolam you can give. Bolus. Okay. Now we'll be performing brachial plexus block using supraclavicular approach. We are doing a landmark technique. So for which the affected side we have to palpate for the subclavian artery and go lateral to the subclavian artery with a needle. Do I have a needle set?
Go ask him.
Get the needle, drug, lignocaine with adrenaline and 0.5% bupivacaine
Now,
Bupivacaine.
and 8 milligram Dexona.
There's no needles per se.
Somebody next to the patient, please.
Sir, I want you to connect the monitors for the patient. This is bupivacaine and 2% lignocaine with adrenaline and 4 milligram Dexona. Okay, sir. Okay, sir. So the patient is stable right now. We've sedated him. We'll be piercing you now. So you might feel slight pain. So hand your non-dominant hand on the pulse and the dominant hand.
Excuse me, ma'am. It's an emergency in the next theatre. This patient is severely hypotensive and bleeding. Can you please come over to help me?
Yeah. Since we've not yet started giving the block here, we would like to request the surgeons to hold on for a minute because we have an emergency situation in the next OT. Meanwhile, you can monitor the patient here while I'll go see the patient in the next theatre.
Yeah, the other problem is resolved. You can go back.
Okay. Now, let's start the procedure.
Madam, is everything okay? Been long time so I'm lying around. What are we doing now?
No. We just abandoned the procedure because there was an emergency in the next operation theatre. So we will be resuming the block now. So
Is
you
it going
can.
to be painful? Is it going to be painful?
No, not at all. It's a small injection in your neck region. You'll feel slight pain when I pierce you with a needle. After which you will feel that your entire upper limb has become heavy and you won't feel any pain. So don't worry. You're fine. Okay. So with your non-dominant hand on the pulse, you pierce lateral in the direction of downward, inward and backward. You're supposed, since this is a blind procedure we are doing, you have to talk to the patient and tell him that when he feels tingling sensation, when he feels shock-like sensation in the upper limb, he should communicate. So when you feel a shock-like sensation in your upper limb, you have to tell me. That's when we know that we are in the right place and we can give you a drug that will anesthetize your upper limb. Okay? So you'll feel slight pain now. Can you feel the shock-like
Madam,
sensation?
that is painful, but I'm feeling a little bit of pain down my legs, madam.
In your legs? We'll just check what's happening. You're fine. I think you're a little anxious, that's all.
Okay.
So just tell me if you have a shock-like sensation in your upper limb. Can you feel anything?
No, madam, everything is okay.
Now?
Yeah, I'm fine, thank you.
Now, shock-like sensation?
Yeah, a little bit of
Now?
numbness down my hand. It's a bit strange feeling down the hands, yes.
It is?
Yeah.
Okay. So, you're supposed to withdraw to make sure that it's not intravascular. So there's
What is the weather in the outside? Is it cold or warm?
it's quite cold because we're in the AC room.
Okay.
So every 2 cc we're supposed to aspirate and check.
Excuse me, ma'am. My SpO2 is 90.
Okay. Madam, I'm feeling very strange now.
What's happening exactly?
I'm feeling a bit lightheaded. I'm not quite sure what's happening, but I don't feel right.
I think
Can I
yes.
keep oxygen?
Yes, we'll abandon.
Yeah, I am having a bit of problem down the face. Oh my god.
Okay, we'll just abandon the procedure.
We don't
Step
have
the
a
nostril. Did you have a step?
we don't have a pulse. We don't have a ECG trace.
Okay.
Are you okay? Are you okay?
Please
Are you
take the
okay?
face mask.
Show me your tongue.
Please take the face mask.
Can we lower the table, please?
Switch on the
Ma'am,
oxygen.
we are starting the CPR.
Yeah, please start the CPR.
Can you somebody lower the table?
Face mask.
Someone lower the table.
Yeah. Okay. Is the bag filling?
Yep.
Continue CPR.
Yep.
I think you have to get
Somebody
ready
time
with.
me. Somebody time me for 2 minutes.
I think you have to try loading adrenaline. Please load IV adrenaline. Get ready with the infusions.
Do you want somebody to bag
inotrope?
him, ma'am?
Bag. He's bagging. Okay, I think we'll go in and secure a definitive airway. Please get ready for intubation. Since bag is filling, it shouldn't be a problem. Bag is
2 minutes.
no
2
oxygen
minutes.
is not.
IV
there.
adrenaline.
Just wait.
Interrupt for rhythm and pulse check. There's no rhythm.
Yeah,
There's no pulse. Continue CPR.
continue CPR and give adrenaline, please. Is everything ready for intubation?
Somebody time adrenaline every 3 to 5 minutes.
Given first shot given.
Take care of adrenaline.
Do we have an IV access?
Yes, we
Somebody
have an
start
IV
crystalloid
access.
fast.
Yes, we have an IV access. And adrenaline is ready. Please get ready with inotrope infusion, sir. Okay, I'm going to attempt intubation now. Please continue CPR.
5 minutes.
Repeat adrenaline. Interrupting for 10 seconds.
Second shot of adrenaline given.
Yeah. Flush, please. Somebody rush crystalloid.
Please give succinylcholine. I'm not able to do propofol first. IV propofol.
Do we have intralipid? Ma'am, did we inject local anesthesia?
Yes, we did inject local anesthesia, but
Please arrange for 100 ml intralipid.
Propofol.
yeah. Propofol and scoline to secure a
propofol in
definitive
running
way.
grip, madam.
Please get intralipid.
Yeah. Start intralipid. This man looks like a 70 kilo young male. We'll give him 100 ml intralipid.
Yeah.
IV stand.
Is succinylcholine given?
Continuing CPR, we have sinus bradycardia.
Yeah, please give
Atropine,
atropine.
please. Atropine. Stat 3 mg atropine. 0.5 mg per ampule. 6
10
ampoules of
minutes.
atropine.
10 minutes.
Sir, can you
Please
please
start.
refresh BP?
Please start intralipid as soon as possible.
I have very faint pulse. Yes, I can feel
Yeah,
pulse.
intralipid started.
Yeah.
Okay, we
good.
have a rhythm. We have a pulse. Sinus tachycardia.
Right.
Pulse palpable. Refresh BP, please. Stable SpO2.
Yes.
Are you fine?
Are you fine?
Are you
Oh, where
fine?
am I?
Are you fine?
Are you fine?
Where am I?
You're right here in the operation theater. Don't worry. We've taken care of the situation. Right?
Please continue to breathe. Take deep breaths.
Keep going.
I'll be giving oxygen through this mask. So please breathe.
Okay, thank you. That's the end of the scenario. Well done. Brilliant. Brilliant.